Alors, comment est-ce qu'on va procéder ce soir? On va faire 2 cas cliniques. Et pour chaque cas clinique, nous allons faire des scénarios. Donc, on va faire un play avec un collègue qui sera volontaire. Et à la fin de chaque cas clinique, on va prendre le temps de commenter, de refléter, de critiquer, d'ajouter, d'améliorer. Comme ça, à la fin, nous tous, on acquiert un peu cette aisance-là. Comme je disais, nous allons utiliser le framework de consultation qu'on a développé la fois passée. Et cet exercice va donc nous aider à maîtriser les différents communication skills qu'on a discutés ensemble. Alors, sans plus tarder, on va commencer avec le tout premier. Comme j'ai dit, j'aurai besoin d'un volontaire. Est-ce que je peux avoir un volontaire qui va jouer le rôle de... Il va jouer le rôle de médecin d'abord. OK, docteur Évariste. Docteur Aimé, vous pouvez ouvrir votre micro, vous serez le médecin. Docteur Évariste.
Oui, bonsoir, docteur.
Bonsoir, docteur. Alors, donc, vous serez le médecin. Je vais jouer au patient.
OK, ça va.
D'accord. Alors, on peut commencer. J'aurai besoin d'une 3e personne qui va nous aider à gérer la cloche et le temps. Hein. On va faire, pour cette consultation, on va faire 14 minutes. Bon, mettons 10 minutes. On va faire 10 minutes et on va arrêter. Est-ce que quelqu'un, docteur Mpiana, tu peux nous aider? Lorsqu'on a atteint 5 minutes, tu vas juste nous dire 5 minutes et puis à 10 minutes, tu vas nous arrêter la séance. Hein?
OK.
D'accord.
Bon, vous pouvez commencer. Hein? Il est 19h52.
D'accord. Nous commençons. Je suis le patient.
OK. Hello, sir.
Hi.
So, okay.
Hello.
Hi, doctor.
Yes, Mr. Kalombo. I will be helping you today. So before we can start, can I confirm your name and date of birth, please?
Yes, doctor. My name is Mr. Mabaso, and I'm 64 years old.
Nice to meet you, Mr. Mapaso. Yes, I just want to assure you that whatever that we are going to discuss tonight is going to be confidential. So feel free to talk and to be open to me. Is that fine with you?
Yes, doctor.
Okay, so Mr. Mapaso, tell me what brings you into.
Doctor, I don't know, but I'm no longer coping with my work. I feel a little bit tired those days.
Okay. So, Mr., you say you are feeling tired. Can you tell me more about the tiredness?
You know, as I go with my day, est-ce qu'on peut fermer les micros, please? As I go with my day, as I go with my day, it becomes more and more difficult for me to finish my task. So I have to take many breaks.
Mr., you have to take many breaks about what you are doing. So what do you think it can be, this tiredness?
On a perdu docteur ou c'est bon? Allô?
Nous vous suivons, docteur.
Ok, est-ce que docteur Évariste est là?
Non.
Docteur Évariste, tu es avec moi?
Il y a moyen d'en mute un peu. Beaucoup de gens ont le micro ouvert, on n'entend rien. Dr Carlos, il peut fermer quand même son micro. Il y a Dr Mwenze, Dr Mukuchene, please.
Hello? Hello, doctor. Hello?
Oui, docteur, je dis si vous pouvez ouvrir votre micro.
Ok, docteur, je suis en ligne. On peut continuer. Hein? C'est moi qui parlais. So, doctor, I'm feeling easily tired. That's why I'm coming to see you. I have to make more effort, take more break before I finish my task.
Vous pouvez unmute Dr. Eva, Dr. Aimé.
Okay. Okay, thank you, doctor. You muted my mic. I couldn't, whatever that I was speaking, you couldn't hear.
Dr. Eva, est-ce que tu peux nous écouter?
Oui, oui, je peux vous écouter maintenant. Allô, docteur?
Dr. Évariste, on t'écoute 5 sur 5.
Ok, merci. Ok. Yes, I was asking, what do you think it can be, this tiredness?
I'm not sure, doctor. Maybe I'm working too much those days. I'm really not sure.
Oh, you are really not. So is there anything else, or it's just the tiredness?
I've also noticed that I'm coughing a little bit more.
Yeah.
Especially at night.
Okay. So when you cough, is it a dry, wet cough?
No, it's a dry cough.
It's a dry. It's since when did you start coughing?
It's also almost 3 weeks now. But some days I don't cough. Some other days I cough.
Okay. Are you also having fever?
No, doctor.
Drenching night sweat?
No.
Okay. So, Mister, tell me, are you married? Hello? Hello, doctor?
Yes, Dr. Eva.
Yes, I was asking, are you married?
Yes, doctor, I'm married.
Okay. Can you tell me more about your family, children, and your wife? Hello? Hello?
Okay, I think the problem is on my side. I'll just try to use a different device.
Okay.
Yeah, I think I'm struggling to follow you. Okay, I'm back online, doctor.
Okay. I was asking about your family. If you are married, how is your family doing?
I'm married. I have 4 kids, and we are all fine.
Okay, thank you. And Mister, are you suffering from any chronic disease?
Doctor, I only take some medication for my knee. I had an accident and I've kept this pain. So I use that painkiller for my knee.
Was it prescribed or it over-the-counter medication?
No, it was prescribed.
Okay, what is the medication?
Oh, it's, I think it's Lyrica. They call it Lyrica.
Lyrica. Okay, thank you. So, Mr. If I can ask more about yourself, have you been admitted before?
Oh, yes. Once I was admitted, it was 4 years back.
Okay, what was the problem?
Oh, when they admitted me, they actually couldn't find what was wrong. They told me everything was okay. I just collapsed at work and they took me to the hospital. And later on, they say everything was fine.
Okay, no, thank you. And your parents, are they still alive?
My parents are still alive, but yeah, they are both sick.
Okay, what is the problem with them?
My father is diabetic, and my mother is she's having also arthritis.
Okay, no, thank you. So, Mr. Tell me, what is your worries today? You have complained about tiredness. So, what is the worry that you have today?
I'm really worried because I cannot make it up with my work. I really have to take many breaks, and I'm not used to take those breaks like that.
Okay, I see. And what would make you happy to say that you have seen a doctor today?
Doctor, if you can just find out what's wrong with me, what's really going on, I will be happy. And okay, if you can also, once you find it, treat this tiredness, I will also be happy.
Okay, so you have just mentioned something that your mother is suffering from sugar diabetes. So I would like to know.
My father is diabetic.
Yeah, your father. Okay, thank you. So are you feeling thirsty more often? Are you drinking a lot of water?
Not really.
Not really. Okay, so tell me, Mister, are you sometimes feeling like you don't enjoy things that you used to enjoy before?
No, I always go on with everything that I do. It's just that I cannot cope physically. I really feel that I have to take many breaks.
Okay. So, Mr. Hearing to this story that you just tell me, I would also like to just examine you so that I can combine this history and the physical examination. I don't know if that is fine with you.
That's okay with me, doctor.
Yes. Before I can examine you, I would like to have some vital signs. So can you tell me how much is your blood sugar today?
Okay, the blood sugar is 9.1.
Oh, okay. It's a little bit high. Did you eat before today?
Yes, I had my breakfast and lunch already.
Oh, okay. The last time you checked it, how much was it?
What do you mean, doctor?
Did you check your sugar before?
No, I usually don't check my sugar.
Okay. And your blood pressure, how much is it?
The blood pressure is 178/110.
This is too high. Okay, so tell me, are you feeling dizzy right now?
No, doctor, I'm not dizzy.
Okay. I would also like to do the urinalysis. How is the protein on the?
No, the urine, the nurse is still bringing the material for urine. It's not yet there.
Oh, okay. Okay, it's fine. So combining my history and just what I have get here following your exam, I would also like to examine your heart, and I would like to first to listen to heart. How is your heartbeat?
Okay, the cardiovascular examination is showing a raised jugular vein pressure, a displaced heartbeat, apex heartbeat, a tachycardia of 104, and there is a soft 2.6 systolic murmur on the mitral area.
Okay. Thank you. So I would like to also ask about abdominal examination. Is there any organomegaly, any organ that is swollen?
No, there is no swollen organ. However, there is a bit of tenderness on the right upper quadrant.
Okay, on the right. And your feet, are they swollen?
Slightly.
Slightly. And is there any pitting edema, or it's just
a slight one?
Swollen and okay, no. Thank you. So, Mr. Taking history and this physical examination, I discovered that you may have heart problem. Your blood pressure is high, and also the examination of your heart. The heart is beating very quickly, and even that beat is not at the place where it is supposed to be. So all this makes me to think about cardiac problem. So I don't know if you agree with me, it can be the heart problem.
Yeah, doctor, I think it might be the heart, because the way I feel it those days is not the same way.
Okay, so but for us to confirm also this diagnosis, we'll have to do some wake up. We'll have to do the echocardia of the echography of the heart. We'll also have to do the ECG, and we'll run some blood tests where we can do the BNP. We can also check the kidney function, and we also going to do full blood count because you have complained also of the tiredness. That is more related to the heart problem, but we can also still rule out any anemia problem as well. So I don't know if all this is fine with you.
Yes, doctor. If you can help us to really make me feel much better. Yes, doctor.
Okay. So because you are not on any medication now, first of all, I would like us to talk about diet. because when someone is having high blood and heart problem, they have to observe a certain diet. So we normally ask people with this kind of problem to first of all to cut down on salt. So you must make sure that the salt that you are eating is not more than 1,500 grams per day. And also we ask them to also eat more veggies and fruit. And apart from the diet, we also put them on medication. So the first line medication that I'm going to put you in, it's hydrochlorothiazide and enalapril. So I don't know if that is fine with you.
That's fine, doctor.
Okay. Yes. I don't know if you have any question, because I think we are done with our consultation of today.
Okay. Thank you, doctor. I don't have question for now. Thank you, Dr. Evariste.
Okay, thank you. So what I will ask you is just the follow-up. I'll give you medication in a short a period of what is the latest that you can come back to me so that I can check you again?
I can come next week, doctor.
Okay. Next week, you can come. Even if I'm not here, our team is already available, and everything that we have talked, it's recorded on your file, so you will get help even if I'm not at the clinic. Thank you.
Thank you, Dr. Evariste.
Thank you.
Okay. Thank you. So let us allow, can we reflect on this consultation? You'll have to raise your hand so we can unmute. Can we reflect on this consultation? Anyone? Dr. Alain? And Dr. Itessa next.
Thank you. Dr. Evariste, thank you for the consultation. In my view, the patient told about tightness and they opened a door of coughing. So the history taking was not enough. Now, there are simple questions like establishing the onset of the cough, establishing the onset of the tightness, the sleeping pattern. There are too many questions you could ask about tightness and about cough. Les signes d'accompagnement. I mean, lorsque le docteur vous a donné les findings, cardiovascular examination, il aurait pu vous dire qu'il avait déjà mal au ventre du côté droit, à l'hypocondre droit. Vous n'avez pas très bien fouillé l'histoire. Quand vous fouillez très bien l'histoire, ça vous met déjà dans la route. Ceci pour rappeler que l'anamnèse, c'est la partie la plus importante. Je crois que vous n'avez pas très bien fouillé l'histoire d'abord de la fatigue et de la toux. Si vous aviez fouillé les deux histoires, vous aurez déjà quelque chose. Bon, maintenant, on vous donne des signes cliniques. C'est bien de dire si c'était le fasting ou les random blood glucose. Ça vous permet déjà d'éliminer, mais il vous dit la tension est à 178 sur 110. Mais il faut poser des questions. Je sais qu'il vous a dit qu'il prenait l'Irica. Il faut aussi connaître les side effects de l'Irica. Il y a la toux et tout ça, l'insomnie qui entre à l'intérieur. Mais quand il vous donne cette pression artérielle, c'est le moment d'aller en profondeur pour demander est-ce que vous l'avez déjà expérimenté dans le passé, comme vous avez...
Dr. Nsaman, try to discuss in English the suggestion from Dr. Chimwanga. I think it's relevant. Yeah. We are exercising this language.
Yeah, thank you. At the time they told you was having 178 over 110, you could go deeper. Ask the patient if he is no hypertension or if previously he had a raised blood pressure, and ask if he's taking any medication, even over the counter.
He did ask that. He asked if I'm on any medication. That way he discovered that I'm on Lyrica. So that was asked.
Okay, then on the end of the consultation...
Can we use the framework? Can we use the framework of last presentation so that we are very systematic?
Okay, thank you, doctor.
So overall, first, do you think that Dr. Evariste has followed the framework?
I will say yes, but when it comes to the conclusion, he talked about clinical assessment. I didn't feel the individual assessment, the contextual assessment.
Yeah, I agree with you.
Okay. So this part I didn't listen. Okay. So when it comes to rice, so maybe he mentioned the idea. Didn't really say more about expectation, even fears.
No, he did touch about expectation.
Okay.
Yeah, he did touch. And maybe just a remark, you know, you don't have to do the whole RICEF. You can do half of the RICEF is enough.
Okay.
The idea here is just to catch up, because the patient will not come within the RICEF, the patient will come with one or two, maybe only 3 elements of the RICEF. Usually they don't come with all of it. You know, it comes with mostly a concern, or it comes with an expectation. It comes with, they come with 2, 3 maximum. So, but he did touch the RICEF. I was happy with his RICEF approach.
Okay, but overall, it was a well-done job. So we will invite Dr. Evariste to keep on the frame of the consultation. Thank you. In conclusion, the history was not deeply, And then, as I say, the 3 stages of the conclusion: clinical assessment, individual, and contextual as well. Thank you.
Okay, thank you, Dr. Alain. Dr. Itesa.
Thank you, Dr. Mbuilu. Dr. Evariste, thank you so much. I joined the group a little bit late. I was not in the beginning, but I'm very proud of you, my brother. In my view, you did well. I followed you the way you went through with your history taking. Though Dr. Alain mentioned something very important as well, that you didn't really deep so that you can establish, because why I'm saying that, the patient says in the physical examination there was a tenderness over the right upper region. So which means you should have dug also the liver area. The patient says that, or the examiner said that there was a raised jugular vein pressure, if I'm not mistaken. And there was slight edema, which maybe with time could get worse. Yes, you did find out where there was edema, where there was pitting edema. But now in your workout, I was expecting you, Dr. Evarist, to check maybe the liver function also, just to exclude if there is any concern around that. And on your diagnosis, I don't know, Dr. Mbuilu will maybe help us to understand. Yes, you wanted to use terms, wording that patient would understand better, but I think your diagnosis could have been scientifically, with scientific terms, but then you explain it in layman terms so that your patient understands it. But your diagnosis was like heart problem, which is your patient, you wanted your patient to understand it, but I think the examiner would like you to hear something more correct, then you break it down so that your patient can understand. So I was expecting on the non-drug treatment that you mentioned that the patient could have some aerobic exercise, physical exercise, like brisk walking 15 to 30 minutes a day, 5 times a day. And yeah, things like that, just to improve or to help prevent some further cardiovascular problem. And maybe the weight of the patient, I didn't hear that. Did you manage something? Did you do some body mass index? And did you manage, did you advise the weight reduction if it was overweight or obese patient? And yeah, how to reduce weight and all that. Yeah, but overall, you did well. I think you passed the station. Thank you.
Okay, thank you, Dr. Itesa. Dr. Chimwanga.
For your brilliant presentation. This was really good. And most of the remark has been already highlighted by the colleagues. I just want to name some of them. You realize that you were not really systematic. In such way, when you get the vital sign, you were coming back to the history. And maybe you had the thing that you had a good patient who were not getting tired of giving you the answer. And for instance, and or treatment, you talk about the patient to reduce the salt intake by 1.5 gram. Being practical, I don't know the patient, how is he going to measure 1.5 gram at home? Although the patient will be using it from the kitchen. We don't have the scale in the kitchen. And also, this is the point that maybe I'll be against Dr. Itesa, by saying that the patient is supposed to start doing the gym, walking. Already, I think Dr. Evarist was supposed to start by assessing the NIA score, because as the person said, maybe supposed to ask the patient how does he feel when he's climbing stairs, mountains, or how many people that use. This will tell us exactly what is happening. And also to rule out stress, because if we could approach him holistically, maybe stress activity as well could be the one leading cause of the hypertension. For instance, to ask why he care about, does he have children, good relationship? So if we take a holistic approach, we may realize that maybe there can be underlying cause, so that we can start putting the patient by starting maybe by a life change modification before we can end up putting the patient on treatment. And the last thing is when we ask the patient still on treatment, what do you think you can come? I think this is the doctor who is the one assessing based on the severity of the disease. The doctor is the one to decide when he would like to see the patient as early as possible so that he can adjust the treatment. Rather than telling the patient, when do you want me to see you again? The patient may say tomorrow, or the patient can say, I will come after 2 months. So the doctor is the one to decide, I suggest you can come after 1 or 2 weeks. What do you think? And the patient will say that, no, I'm a bit busy. And what if we, after a week, the patient will say, okay, for this one, then we can come up with an agreement so that we can get a proper timetable. Thank you so much. But it was brilliant. Thank you. Congratulations.
Okay, thank you, Dr. Chimwanga. Okay, so all the remarks are welcome and they are relevant. I want to first say we need to read our guideline. In the guideline for hypertension, for heart failure, it's clear when you have to review your patient. You don't have to make it up. So they say when you have what we call hypertensive urgency, you have to see the patient within 48 hours. Is in the guideline. For a new onset, or if you start new medication like diuretic, you need to see the patient within the first 2 weeks so that you can adjust the medication. And so on, it goes on. So those follow-up are not made up by the doctor. They are actually in the guideline, but the doctor, as Dr. Chimwanga is saying, can also use his own discretion to give, follow-up. Now, Dr. Itesa has also said, and I agree, the framework. You know, I'll give you one golden advice here. Try to follow, you know, the patient can go left and right, up and down. The doctor should stay within the framework. I just gave a link of a summary of of Tuesday presentation. That framework where you start with introducing the consultation, setting up the agenda, discussing patient perspective or RICEF. When you finish RICEF, you move into your biomedical framework where you discuss now the disease, including the background of the patient, where it is working, past medical history. You finish by a summary that takes you to a transition to physical examination. Please follow this framework the way it is. Don't start doing physical examination and you go back to asking questions about the RICEF. While you are giving a feedback to the patient, you go back to ask if the patient is smoking or using alcohol. So try to stick and use your transition period to actually catch up on what you have missed during your history taking. It is very important. So what I want us to do is to use the same case, but to take the framework that we have learned pieces by pieces so that we can actually use those communication skills. So can we have maybe any other doctor? We are going to try to do part by part. So we'll build up this case as a learning case, and we'll come up with a good understanding of what we mean by framework. Can I have a volunteer? Okay, who can volunteer? I don't see end. I'm going to choose one. Don't leave the meeting. Two left. No way. Don't leave the meeting. Okay, who is the volunteer? Actually, I will need one volunteer to do the RICEF, one volunteer to do the biomedical, one volunteer to do the past history, one volunteer to do the summarization. So I'll need at least 6 to 7 volunteers. Let's start with the first one. Okay, I'll take the name that is up. Dr. Evariste, let's restart with you.
Okay.
Okay, so you are the doctor, I'm the patient. Your task as a doctor is to introduce this consultation and to complete a good, I'll say, individual assessment. So we are doing only the RICEF. So don't go out, you introduce, you carry the consultation until you finish completely the RICEF. So let's go on.
Okay, hello, mister.
Hi, doctor.
Yes, can you tell me what is the reason for your consultation today?
Okay, we stop there. Let's go back. Improve.
Yes, Mr.
Do you know my name?
Tell me what.
Did you introduce
I
yourself?
forgot.
Okay, let me put this. Let me give you a short screen because that. Have you seen the? Have you seen this screen? I send you the link. Did you access it?
Not yet.
Not yet. Okay, so this one is a.
Okay, so I'm starting from the beginning, doctor.
Yes, please.
Okay. Yes. Hello, sir.
Hi, doctor.
Yes, Dr. Kalombo. I'm going to examine you, assess you today. So before we can start, can I confirm your name and date of birth, please?
My name is Mr. Mabaso. I'm 64 years old.
Okay. Do you have any question before we start?
No, doctor.
Okay, thank you. So, Mr. Mabaso, can you tell me what brings you in today?
Doctor, I have this shortness of breath that is bothering me.
Okay. So, Mr., tell me a bit more about the shortness of breath.
Yes, doctor. You know, for the last 3 weeks, every time I have to do anything physical, go from my room to my bathroom, or even go and get into my car or come take the stairs to my office, it's so difficult. I have to take many breaks.
Oh, okay. No, I understand that. So tell me, since when have you been experiencing this?
It's now 3 weeks, doctor.
Okay. Before it was not like that, if I may understand.
No, I was not paying attention. Now I'm really paying attention because it's just getting worse every day.
Okay. Yeah, thank you. So, Mr. Mabaso, I would like to know, what do you think this can be? Because it was not there before.
Doctor, I'm not sure. Maybe my smoking is making it worse, but I've tried to stop. I don't know. I really don't know, doctor. I've tried to stop, but it's still there.
Okay. So you stopped smoking?
Yes, doctor.
That's a very good decision that you have made. Congratulations for that. So, Mr. Mabaso, now I would like to know what makes you worry about this experience of shortness while doing small job?
But because I cannot complete my job, I think I'll get into trouble at work because I'm no longer performing at work the way I used to.
I see that. I'm sorry to hear that you can't perform the way you used to. But then tell me, Mr. Mabaso, what will make you happy that you have seen a doctor today?
Doctor, if I can be strong again and, go on fixing the shelf at work, I'll be really happy.
Oh, no, we'll have to work on that. And do you have any fear about this?
I may lose my job, doctor.
Oh, yeah, I see. Okay. I think, doctor, I'm done with rice.
Okay. Give a summary.
Okay.
Give a summary to the patient.
Okay. So, Mr. Mabaso, I understand that you have come with this shortness of breath that you didn't have before. And this is happening mostly when you are trying to do the job you used to do before. And you are really worried about it. And you are also concerned that you may lose your job. Yeah. So, but before you can get there, so I'm going to investigate more so that we can uncover what is the problem.
That's
really.
Not a summary, doctor. That's not a summary.
Oh.
And you are giving a lot of promise, doctor? Okay, thank you, doctor. That was a good try.
Doctor. Okay.
Let me try to give a summary because we are all doing this exercise together. So this is what I'll do if I was the doctor. I'll say, Mr. Mabaso, I've listened to you carefully. You came to see me because you have this shortness of breath, and this shortness of breath is now going on for 3 weeks. Is really affecting your work, and you think it's getting worse because of your smoking, and you are afraid that you may lose your job. So this consultation, you are really expecting that at the end, I may give you something or treat you so that you can be performant again at work. Did I catch you well, Mr. Mabaso? How do you think about that summary?
Oh, okay.
It's few wording, few sentence, but it goes straight to. Someone want to play now the biomedical doctor, another volunteer. So we have completed the RICEF. We have introduced the consultation. We have introduced the RICEF. We have given a small summary. Now someone must take up the next step, which is to do the biomedical framework. Et volontiers, docteur, soyez courageux, on s'exerce. Il faut faire des erreurs maintenant. Quand on est en famille, là, fermé. Je prends au hasard. Docteur Brinton. Docteur Brinton, est-ce que tu es avec nous? Docteur Dandou. Ton micro est ouvert, docteur. Tu peux parler. what I'm expecting from you is take us through questions, open-ended question, closed question, silence, clarification, all those skills. Use them to bring me from the biomedical framework. It means the history of the current disease according to the doctor agenda. And take a past medical, surgical, gynecological history. Take a history from my hobby and occupation. And finally, have this sense of where I'm living, how is the family, and so on. So can we go through that?
Okay. Okay, I'd like now to ask you a few questions. So this fatigue, shortness of breath, it started when exactly?
Okay, I'll stop you there. What skills do you use for your first question? If you were there, you'll use the open-ended question here. This is where you use the open-ended question. Can you use an open-ended question on shortness of breath? Open-ended question. It's tell me more about this shortness of breath.
Okay.
Okay. So go on, ask that question.
Okay. Can you tell me more about the shortness of breath that you are experiencing?
Yes, Dr. Brinton. You know, now I used to take the stairs in one go. When I go, I'm going to my office. Now, doctor, 3 weeks back, I have to stop twice. This week, I have to stop 4 times. And, you know, since yesterday, I went to work. I couldn't even, you know, go on. I have to use the lift. I usually don't like the lift because I'm claustrophobic. But this time I say it's better to actually have my panic attack than to take the stairs. So doctor, is just getting worse and worse. And now even a simple walk from my bedroom to my bathroom, which is just next door, I have to stop a little bit. I have to take many pauses. So that's how bad is this shortness of breath.
Okay, I get you. Is there any other problem like cough? Are you coughing also?
Okay, yes, doctor. I'm coughing mostly at night. Yeah, that's all.
Okay, and at night when you sleep late, are you urged to wake up because the shortness of breath is coming also?
Yeah, I wake up many times. I can't even sleep flat, doctor, as you say. I have to put 3 pillows. Now I'm using almost 4 pillows to be comfortable. So I sleep almost sitting.
Okay, I get it. I want to know, do you have any disease for which you are taking some medication?
Okay, I'll stop you again there, doctor. This is a good, you know, when you change spaces, when you change section, use open-ended question. Get me an open-ended question there.
Okay. I use
I'll help you because it's an exercise. So I'll ask like this. I'll say, Mr. Mabaso, can you now tell me about your previous health?
Okay.
You can just stop there. Isn't it? Isn't it an open question?
Okay.
Can you tell me about your previous health? Okay, so if you ask that question, I'll say, oh, yes, doctor, I was admitted 3 years ago for, I just collapsed. And so they found nothing. I had a car accident and I had an amputation below my left knee. So I'm using this medication all the time because I always feel that my knee itches and there are like hands walking there. But the medication that I take, which is Lyrica, helped me with that feeling. And yeah, that's all about my health.
Okay. Are you, apart from Lyrica that you are taking for the pain, is there any other medication are you taking?
No, doctor, that's the only medication I take.
Okay, thank you. Are you smoking or drinking alcohol?
Yes, doctor, I smoke, but socially.
Is there any other problem like allergy to medication? Any allergies?
Just on pineapple. I don't eat pineapple.
Okay, can you tell me about the setting of your family? Are you married? Did you have some children also?
I'm married, doctor. I have 4 children, and everything is going well.
Oh.
Yeah.
Okay. This fatigue, you told me about fatigue. I wanted to know, is there something that is bothering you? Maybe you are stressed about something else.
Okay, that question, doctor, is coming. Why is it coming?
Yeah, is in the history to rule out any other complaint, any other concern that can explain the fatigue also in a psychological area?
No, in the frame. Where do you put that? Is it past medical history? Is it, what is it? Where are you?
It's in the past medical, I think in a personal, in a frame, a medical history, I can say that.
No, it's not there. You are done with the patient. You have your diagnosis. We say you need to be like a concrete. When you finish a section, you forgot about it. You only come when you are doing your summary, and we must see that, oh, I'm doing my summary and I forgot this. Then you throw that question. So don't bring up questions that are not in the frame.
Okay.
You know, if you use the frame, you'll be really superb. Okay, I think what you have done so far is fine. So we'll stop there with you. I just want to take anyone in the group, a volunteer who has a case that you can play, a patient that you have seen that you can remember, a true patient where you remember some of the, we are going to play a case. I'm going to play the doctor and we'll finish there. I want a volunteer to come up with a case. Not the case that we have played now. We have played a heart failure, smoking, and blah, blah. Dr. Itesa. Dr. Itesa, you are going to play a case now, and we are just going to do the first part, just to see how we are going to flow. And I'm going to try to be the doctor, and so you'll follow how we go. Okay, Dr. Itesa. I am the doctor. So, Dr. Mpiana, you are the coach. So you'll tell us when to start. You'll stop us when it's 7 minutes.
Okay, but don't you must let my mic open. because last time I struggled to tell you to stop.
Oh, sorry. Okay, you know, I've put you as a co-host, so you should be able to. Oh, you went out.
I'm not a co-host since the beginning.
No, you're a co-host,
Now.
Dr. Mpiana. I always put you co-host. You don't know that.
Okay, thank you. Yeah.
Can we start?
Yes. You say this for 7 minutes.
7 minutes.
Okay. You can start now.
Thank you. Hi, sir.
Good morning, doctor.
My name is Dr. Mbuilu. I will be your doctor today. How should I address you?
Call me Race, doc.
Race. You have said Race, Mr. Race.
Yes, doc.
Okay, Mr. Race, how old are you?
Doc, I'm 38.
Okay, and what do you do in life? What is your occupation?
I'm an educator.
I see. Mr. Race, you are visiting me today. May I know what is the reason for your visit?
Doc, I hope you'll help me. You know, I've got this headache. It's really bothering me.
Mm-hmm.
Really, I need some help. That's why I'm here, doc.
How is your headache as we speak?
It's so painful that I can't focus.
Can I offer you paracetamol? I have some tablet of paracetamol before we continue.
I would like that as long as it helps, doc. Thank you so much.
Okay, so I'll just take a little break. I'll go next door and bring some paracetamol. Okay, Mr. Reis. Are you comfortable now? Or we may wait for a few minutes again?
No, we can go on. I feel like it's kind of help, though not okay. But I think let's go on with the consultation. At the end of it, I might be okay.
Okay, Mr. Reis, can you tell me more about your headache?
My headache is affecting my eye, doc, and I can't sleep.
Mm-hmm.
As I said, I'm really worried, doc.
What worries you about this headache?
I lost my father, and he was complaining about this kind of the same headache. Maybe I'm dying anytime soon. And when I think about my family that I love so much, it really breaks my heart that they'll be left alone with no one helping them.
I'm sorry to hear that you lost your father. When did it happen?
It happened 7 years ago. He was a good man. He took care of us. He brought us up well as a family. But we had to lose him just because of a headache. That day he woke up, complaining about the headache. Very painful headache. We rushed him to the hospital and he passed on.
That's really sad. Mr. Reis, tell me, what do you think could be causing this headache?
Maybe a brain tumor, because my father, according to the treating doctor, I had a chance to talk to him. He told me that he had something like a brain tumor or something. You know, you doctors got your own jargon. That's how I understood it. I'm afraid it can be the same thing.
I see. And at the end of this consultation, Mr. Reis, what will make you happy to say that you have really met a doctor?
If I can sleep again during the night, if I can cope with my work, I'll be very much happy, Doc.
I hear you. And what's the worst idea that goes in your mind about this headache?
Death, Doc. I don't want to end up like my father.
2 minutes left. Huh?
I hear you. So this headache that you have around your eyes, that you also have now, tell me, when did you start to feel that headache? When did it start exactly?
It started 2 months ago. It's on and off.
And what kind of headache is it? How do you describe it?
It's excruciating, Doc.
Have you noticed something that makes the headache worse or better?
Especially when I'm facing a light. You know, when I'm using my computer, this might get worse. And I'll find out my eyes are tearing.
And which side of your head is mostly affected?
The right side, Doc.
Is it only the right side? Always the right side?
Mostly.
Mostly the right side. Okay, have you noticed any change or any other sign on you, like vomiting or fever while you're having this headache?
No fever, no vomiting, Doc.
Time is up. You have exhausted.
Thank you, doctor. Minutes. Thank you, but you could have left us continue.
Yes, you can carry on,
okay,
but
okay.
just to let you know that the time is up. You can carry on.
Okay, thank you, Dr. Mpiana. Yeah, but we can continue a little bit, isn't it?
Yes, Doc.
Yes,
no
I give you 3 minutes more.
No, let's continue and see how it's going to play out. Yes, doctor. So, you say this headache has been going on for 2 months. Have you tried something to stop this headache?
I try your normal Panado, Grandpa. It will make you feel as if you're okay, but then it will come back.
How often you get this headache in a given week?
I can have it twice a week. Yeah.
And how long they last for each crisis?
It can last from 30 minutes to an hour or so. I remember one day it went up to 3 hours. That was bad. My wife started crying. She thought that she's losing me.
That's bad. And have you noticed before the headache starts any other sign or symptom that usually comes right before? Have you noticed any of those?
No. Oh no, I haven't noticed anything unless it came unaware.
Mr. Reis, so you are 38-year-old. Tell me about your last 38 years of your health. How have you been about your health?
You know, I'm a healthy guy. I never really consulted a doctor. apart from, since he started, I've been from one doctor to another. They can't really help.
So you are telling me that you have never been sick, you are not on chronic medication, you have never been admitted or had a surgery?
No, doc.
Okay, you also told me that your wife was worried about this headache. Tell me about your family life.
Yeah, I'm married. I've got 2 cute boys that I love so much. I adore my wife. Yeah, I would say I'm happy on that side. Yeah, family-wise, doc, I don't want to lie, I'm happy.
Okay, you also told me that you are an educator. Tell me about your work. Is it a stressful one? Are you coping?
I'm teaching grade 11 kids. Yo, they can give you
what subject?
Okay, physics, eh?
Oh,
Physics.
that's a tough one. Are you coping at work?
I would say I'm trying.
Yeah, educator with many kids is always, it's always a little bit complex and difficult. And when you are not at work, what do you like to do?
Look, parents are not helping. They leave all the job to the educator.
Absolutely.
So they don't really do their part. Yes. You said again, I beg your pardon?
I say, when you are not at work, what do you like to do in your free time?
I spend my time with my family, yeah.
Oh, and do you play soccer, any sport, or what do you like to do as a hobby?
I watch soccer with my kids. Yeah, I do. And I like swimming. Yeah. Sometimes taking a trip, going away as a family.
Oh,
yeah.
That's good. In your life, did you ever drink alcohol?
Occasionally. I'm not a drinker.
What do you mean by that? What do you mean?
It might be after 3 months, then I'll drink a red wine. After another, there has to be an occasion for me to drink.
I see. And when it's happened that you drink, do you get drunk?
No. I love my family. I know that I have to drive back home, and I don't want to expose them with all this road traffic accident and so. So I want to be focused. I want to be sober when I'm driving.
I see. And usually when people drink, they also smoke. Have you ever smoked in your life?
I tried, but apparently it's not my thing. I just
Tell me about that episode of you trying to smoke. What has happened? How long did it take?
2 months or so. Then I had to stop. I realized that it can get you addicted. Then I didn't want to deal with an addiction.
And when was it, Mr. Reis?
Yeah, it was 2 months ago.
I see. What has triggered you? What is bring you to start smoking? And although you have stopped?
Stress, doc. I believe so. After work, you see colleagues going out and smoking, and then you feel like doing so. And it brings you some sort of relief, but then, yeah.
Okay, Mr. Reis. Mr. Reis, I've listened to you carefully. You have this terrible headache that was even worse as you came in this consulting room. And you think that this headache might be related or the same as the one that your father had when he passed on. There is no vomiting or fever coming with this headache. Your work, you describe it as a little bit stressful. And you really expect that we understand or discover what is below this headache. And of course, give you a proper treatment. At this stage, I'm going to examine you so that I can find out what exactly is going on with you. What I'm going to do, I'll take your blood pressure, I'll take your heart rate, I'm going to take your temperature, and then I'll do what we call a cranial nerve examination, but also I'll examine your brain with a few movement, and I'll ask you a few questions. And after that, I'll also generally look at your body. And then we'll come back to sit and we'll have a discussion about what I found from listening to you and from examining you. Do you allow me to examine you, Mr. Reis?
Go ahead, Doc. Thank you.
Okay, we may stop there. Dr. Mpiana. Okay, so I'll leave everyone to reflect on this last consultation that we have done. Yeah, as I say, I'll leave everyone to reflect on this consultation. We are going to stop here for today. I see one hand raised, Dr. Chimwanga. Dr. Chimwanga, you want to say something?
Yes, Doctor, thank you so much for this brilliant presentation. But I've observed one thing which was not explored. Mr. Reis seems to be very sad, even by the tone of voice. I don't know, but that aspect was not explored. Is he depressed? Is there anything that he wants to tell but he's hiding? I don't know. How can you try to prompt it from the patient? Thank you so much.
Yeah, you are right. You know, they are not a perfect consultation. They will not be. The main problem with consultation is the time. Usually you have a time constraint. If you have all your time on earth, you'll really go through exploring all of that. Someone who comes with pain, acute pain like this one, acute headache, that might be from cluster migraine, so primary headache, to secondary headache, so caused by tumor, or even tension headache, part of the primary, can also have an underlying depression and stress. So you should explore it. To explore depression, of course, there are many techniques. You can use the what we call PHQ-2. So you ask if the patient has lost interest, if he has lost energy, and if he say yes to one of the two, then you have to screen completely for depression or with all the question that we know. But as I say, you have seen how in 7 minutes we couldn't even go through the whole lot of details. So, but the aim was to give you the dynamic of this kind of consultation. Okay. Any other reflection? Someone want to comment? Dr. Reis, yourself, can you comment? Oh, I see Jeanette. Let's give Jeanette a chance.
Okay, thank you. Thank you so much, Doctor. I would like to ask, during the station, whenever we arrive on the examination part, are we allowed to continue with the examination, or we just do the history taking and we stop by there according to the time? Or if we do have time, can we take over with the examination of the patient?
Usually they will stop you. You need to say, I'm going to examine you. The examiner will say, no, don't examine, I'm going to give you the findings. So you have to do a normal consultation. At this stage, I'm going to examine you. And you explain what you're going to examine. The examiner will say, no, doctor, don't examine, stay on your chair. What do you want? Or he's going to say, this is the findings, the blood pressure, the temperature, and what you have found. So you should actually go on, and you must be stopped by the examiner. Or they will tell you before you go into the station, they will say, when you go in, don't examine the patient. There will be a paper with all the physical examination findings. So it all depends, Dr. Jeanette. Dr. Alain?
Thank you so much.
Yes, Dr.
Thank you, Doc.
Dr. Mpiana will be the last one to comment.
Yeah. I would like just to say that this is something all of us we can build on. You know, usually when we are preparing OSCE, you can feel that we are running it like a robot. But by listening to you, you approach all the steps. You cannot detect that you are going from step 1 to step 2. It was just like a fluent conversation, a brilliant presentation. Yeah. So, and then the only thing I would like to add, this very important question when you are concluding, to ask the patient if there is a question or if there is something he would like you to approach that you didn't do.
I agree with you.
Thank you, Dr. Jody. Thank you for all the work you're doing.
Okay. Dr. Mpiana.
Thank you very much, Doc, and also to congratulate your patient. He played it in a good way, and it was a good simulation from his part. But I would like just try. I would like to reflect on something that I noticed during your conversation with your patient. Is it normal in each and every consultation, more especially in the headache like this, to rate at least this headache of a certain on a certain score, so that you may appreciate what would be the medication that you can offer to the patient? Because going through some of the books, it says that when the score is 0 to 3, you can just offer Panado. When the score is 4 to 6, you can give some codeine, painkillers, and when it is 7 to 10.
Dr. Mpiana, I agree with you.
Yeah,
I agree. So if you can do that, include some scaling of headache and give the treatment accordingly.
Okay.
I totally agree. Yeah.
Okay, but another issue. I noticed that you tried to introduce another issue during your conversation with your patient, more specifically when you say that it's smoking. Yeah, with the time that usually we get from the OSCE, do you think it will assist by discussing the issue of smoking instead of making a schedule so that you discuss it furthermore?
Yeah, I will not do that. I will not go in details the way I went.
Yeah.
But remember, this was not yet a time management training, because there is a consultation time management training that we could do. This was actually to explore the frame, how it flows. That was the aim of this exercise. It was to show you how the frame flow. That's why I say, give me any case and we are going to stick to the frame.
Okay.
Of course, if during an exam you don't have all the time, so you can still use the frame and skip some of the elements, that are not important. Smoking, if you say, yes, I'm smoking socially, yeah, you don't have to go and understand it happened 2 months ago, he smoked for 2 months, and it was how many cigarettes. It all depends on the dynamic. And, you know, if you have a lot of information on your biomedical quickly and you gain time, you can use that time that you have gained to actually explore more aspect of other issue. But if you are struggling to get a diagnosis, then you cannot spend time looking for if he's drinking or smoking, or you'll just touch them to say, I can also touch this. So it all depends on the complexity of your case, the dynamic of your conversation. And if they have make it more tough, if they have make it simple, then, you know, show that you can go into those details. That time management.
Okay.
Yeah.
That's good.
Dr. Ikesa, do you really want to talk? We have to stop.
Just to conclude, 2 minutes, Doc.
Okay.
I'm impressed in the way you led the conversation. Frame wise, everything were followed up. The way you build rapport with the patient, your open-ended question. I like your 3-stage assessment. I could feel it, and also your RISEF. You really, to me, you had a diagnosis already. You just wanted to be sure about what really disturb the patient. So yeah, to me it was well done, and I'm sure your diagnosis was cluster headache.
Yeah.
You actually mentioned that.
Yeah. So the whole aim,
so
as I say, yeah, the aim was to show the frame, how the frame work in a dynamic consultation. And I don't know who has mentioned that you need to exercise that, and you can do it anywhere you are on your time, especially if you are going for an exam. Put the frame in front of you. I don't have one now, but I have a book here. I think that frame is even in the book. So get the frame. Yeah, it's here. So open the book, put it in front of you and follow it. You can do that, especially when you are training. And so I'll just tell you what was going in my mind as I was consulting the patient. As I was consulting the patient, I was really aware of what step is coming next. I knew. I was also aware of all the cue that the patient was leaving. Because in one stage, the patient say, I'm stressed about my father. He also gave another cue to say, my father died, and I think is the same problem. So you take all the cue, but you are aware of what step am I doing now? Am I doing the idea? Am I doing the expectation? What am I going to do after expectation? So you must really know what next, and you must know what information the patient is bringing to you. You must also know how to juggle that. Now I'm dealing with the past medical history, or I finished the past medical, surgical, and gynae history. I'm now going to talk about the family or the drugs, and you can bring up and listen to this way of bringing up information that you already had to introduce the next topic. So you say, you just told me that you are an educator. Can you tell me about how you are coping at work? That's the way you bring up all the parts together. You bring all those parts together in a consultation. So use the information that you had, use the information that you are getting now to bring up the next part, because the part, someone who is listening to you must see that all the parts are connected. and you connect them. You force the connection because you are leading these communication skills. You are the doctor. You respect your patient who must talk freely. You don't interrupt the patient, but you have a frame that you have to follow. Of course, keep in mind Dr. Mpiana remarked that you only have 14 minutes of talking without examination. So it's a lot, but it's also short. So you need to practice 14 minutes of history taking. It comes with practice. As you practice, you'll even understand that in 2 minutes you can do your ISF, or 3 minutes you do your ISF. In 5 minutes you can do your biomedical, and in 3 minutes you can do your feedback and assessment. In the remaining 3 to 5 minutes you can do the treatment plan, the 4 stage. So it goes back to training. So we are going to stop here today. I think Dr. Mukeba is given you the details of how the training will go till next week, Wednesday. So hopefully, I think tomorrow there is already one that will take place. I'm not sure when, but we'll confirm in the group. Having said that, I wish you good evening and see you soon. Bye.
Thank you. Are you gonna post? Are you gonna send us the link? Because I record only one part of it. The previous one.
Il avait dit que les médicaments ici qui vous aident à évoluer, contrôle aussi la tension. Le malade avait dit que les médicaments ici étaient censés contrôler la tension. Non, celui-là. Non, le gynécologue, il ne m'a pas rappelé. Oui, parce que justement, celui-ci qu'on a acheté, ça contrôle aussi la tension. Oui, c'est ce que tu m'as dit. Mais prendre ça et amlodipine 10 mg, j'aimerais quand même me préciser. Oui, s'il me dit non, ça va donner, il n'y a pas de problème. Ok, ça va. C'est un peu curieux, vous avez pris la zik, mais la concentration pas à 14. Voilà pour amener vos injections.